Thanks, everybody. First of all, I think it's great to see the room so full. It says, that you're interested in palliative care, you're interested in research, and you're interested in, the subject of the symposium. And it does my heart good to see that. So I'm going to myself and Niall, so I'm Barry Quinn, say I chair the special research interest group looking at psychology, social and spiritual care. Vital components of palliative care, but often more hidden. So it's great to see it getting focused today. So just to say the caveat, these are just highlights from the survey. You'll get these slides, but also we will move towards a publication. So the group itself, the interest group, was formed in 2023, and it's made of PCRN members, ECRF and Voices for Carers. We wanted to carry out a survey across the island of Ireland to see what was going on. The first phase was to ask healthcare professionals. The second phase will be to talk to users and carers. And the survey was sent out thanks to Mary and Jane and the All Ireland Institute for sending out the survey. And I'm sure many of you actually completed the survey. Some of the things, so the vast majority of people who responded were between 34 and 64 years of age. So these are healthcare professionals. Where their gender identity, the vast majority of people identified with a pronoun as she, her. When we asked people something about their spirituality and religion, you can see that over 100 of 151 respondees identified as Christian, followed by 28 who said they were spiritual but not religious, and 12 who said they were neither spiritual or religious. The number of people you can see, the most respondents were nurses, 69%. That's really important when you look at some of the responses, followed by social workers. And if you put chaplains and pastoral care workers together, they were the next biggest number, 14. Again, I think this is really interesting that the majority of people were working in palliative care for over 6 years, so a lot of experience there. And when we asked, where did you work? So again, not surprising, hospice, community and hospitals, again, across the island of Ireland. So I'm just going to talk a little bit about the spiritual component, and then Niall will talk about the psychological component. Now, I think the qualitative data is really fascinating. So we asked people, could you describe in your own words the role of spiritual care in palliative care? And what we found is the first theme was that respondents recognise that spirituality is an integral component of palliative care. And we've heard Rory and we've heard others talk about holistic care. One person said spiritual care is an essential component of offering holistic care. I sometimes say to students, if we're not going to engage with spiritual care, let's stop using the word holistic. Let's stop it. Let's be honest. Again, a theme came up was about personhood and existential issues, and a person said, taking into consideration, in essence, the whole person, giving space to finding meaning in death and dying. Now, I think these respondents show great insight into what spirituality is about, and I've been interested in this for a number of years. Again, it was about people's values and beliefs. Spiritual care relates to attending to and responding to the beliefs and values of the person living with advanced illness. And I love that idea of attending to, which I think is important. And again, that the fourth theme was spiritual care is a form of guidance through a journey. It is walking the palliative care journey alongside them. And Alistair Campbell, who is a pastoral care chaplain, talked about this idea of being skilled companions. So healthcare professionals use their clinical skills, but also this companionship that came through in this theme. We looked at the quantitative data, so I think this is really interesting and really heartening, I think, that the majority of respondents, over 100, probably 110, said we are actually engaged in supporting people with spiritual care needs. I think this is fascinating that over 80 people, or over 80 persons, so over half of the respondents said, we feel competent or very competent in supporting people with spiritual care needs. But just be mindful, there is a request from these respondents. Again, we asked them how much training you got, and actually the vast majority of people either seldom or never had any training. So there is something about the lived experience of a healthcare professional, learning as they go along. So, I think just keep that in mind. You have a lot of people saying, we are confident, we are competent, so where did they get this training? So lived experience of the healthcare professional, really important. Okay, we asked people, how do you assess people's family and carers' needs? And very much it was about talking. It's about talking, really important, often underestimated. And I'd like to think with that talking is the listening, but the talking to the patient, talking to the family, and something about observing and closely followed by working closely with the chaplain and the pastoral care team, really important. How do you, if you identify, what do you do? So people offer support. They refer to the chaplain and pastoral care team either internally or externally, and that is sometimes about resource issue. So again, Rory, etc., when you're thinking about allocating resources, this is an issue. Sometimes people have to go outside the team, and again, there was some referral to the psychologist or the counsellor. What interventions do you use to support people with or patient or family carers with spiritual needs? And you can see really a lot of it was about providing an opportunity to talk. Again, very, very hard to measure how we do that, but that's really important. Getting advice from our chaplains and our pastoral care workers. I love this idea of bringing people to a quiet place, bringing them to the garden, and maybe offering mindfulness. So again, these are just caveats. What are the challenges? Of course, I always say whenever there's a challenge, there's always an opportunity. So every one of these challenges is an opportunity. So limited access to spiritual care services. So this is a resource issue. Lack of time. And again, I think this is an interesting one which could be looked at in a lot more detail. Patients, family, and carers are unwilling or resistant to discuss spiritual needs. Now, that could be something about our society across the island, but it could also be something about the services in which this is delivered. And then what resources do you need? And by far, they want more training in how to identify and address spiritual needs, mindful of the competence they spoke about. So we are competent, but we need help. So there's an ask for help. And again, really closely followed by, we need more staff who are expert in this field. So I'm going to hand you over to Niall, who will deal with the psychological component. Thanks, Niall.
Thanks, Barry. So I think we're doing pretty well, Barry. When we sat down to try and distill the survey, there was so much rich information that we really didn't know how we were going to condense it to a 15-minute slot. And I warned about the hospital pass, where it's 20 slides to cover in about a minute, so that hasn't happened, so thank you. But I better not derail it now, so I'll get going. So in terms of psychological care, so again, there was 4 core themes identified in terms of psychological care. So the first theme, psychological care as a cornerstone of the holistic positive care model. So the respondents spoke about how psychological care provides a safe, non-judgmental space where people feel enabled to express thoughts, feelings and emotions, where they feel heard, where they feel valued, and that this has a huge impact on their physical experience as well. And we refer to the idea of total pain very commonly in palliative care, that it's rarely just a physical phenomenon, it's a whole body experience of psychological, spiritual and physical pain at times. The second theme touched upon the need to facilitate supportive therapeutic space for both the patient and their family. So we need to give people an opportunity to express what they're wrestling with emotionally, psychologically, via therapeutic and skilled conversation. We need to focus on alleviating psychological distress, but by also building on existing coping resources. So a cornerstone of psychological care, as participants perceive it, is actually finding out what have people been doing, what have people been relying on, what are the resources at their disposal across the lifespan, not just now, that they can draw upon and grow and nurture in this time of need and time of distress. And the final theme touches upon this in a similar way, that we need to build resilience, not just focus on distress and deficit, so to speak. So moving into the quantitative data, again, this very closely paralleled the quantitative data from the spiritual domain, where we saw that the vast majority of practitioners are actively engaged and interested in psychological care needs as part of palliative care delivery. People perceive themselves as being very competent or competent for the most part. Unfortunately, this doesn't align fully with the level of formal training that's available or has been available up to now for practitioners in terms of delivering evidence-based psychological care. How do people assess patients and family or carers' psychological needs? Well, conversing and talking with the patient themselves, talking with family members, observation of the patient or family member, review of medical records. Of note, I suppose, in this finding is that the use of actual standardised metrics or measures is well down the list, only cited by about 14.5% of respondents. When people identify any type of psychological need in a patient or family member, what do they do next? Well, they refer to a health and social care professional on the team generally, social work, pastoral care, chaplaincy, psychology, and that, if that's not available internally, to seek that resource externally. In terms of approaches, non-pharmacological approaches to supporting psychological needs, general psychosocial support, mindfulness strategies, problem-solving therapy, compassion-focused therapy, music therapy were the most frequently cited interventions. And again, pointing to the need for further research in this area, we see that some of the interventions that would have a more robust evidence base, such as CBT, dignity therapy, are actually much further down the list. Apologies for the misalignment of some of the visuals here. So I suppose one of the big challenges, and unsurprisingly, people cited the lack of access to psychological services. So I see the response rate for the survey in terms of psychologists was 3. That's about full participation of every single psychologist on the island of Ireland, up to recently working in palliative care. There was little or no resource for psychological care. Thankfully, that will change thanks to the new adult palliative care policy, where the staffing recommendations have been substantially improved upon. I suppose the only way was up, but definitely the recommendations there are very robust, and with those resources in place in due course, this problem should go a long way to resolving this problem, I guess. People are also asking for additional staff with expertise in psychological care and mental health, more training on how to upskill and learn the nuances of how to assess and identify and treat people's psychological needs. So I suppose to summarise then some of the key themes or gaps in training needs that were identified as part of the survey. From a spiritual point of view, people were looking for more input in terms of self-care, practical skills to address spirituality, skills to identify and assess spiritual need, a better understanding of spirituality and religion, and a greater awareness of culture and those who may feel excluded or ostracised. From a psychological care point of view, there was a need identified in terms of training on assessment and identification of psychological needs, knowing when to refer and who to refer to for further input or support, signposting to available services, communication and conversations around psychological care and support, mental health engagement, and additional support in dealing with grief and loss. Thank you.